Hi class, my name is Nancy Gomez Fajardo, and today we'll be going over the disorders of the auditory system. So I'll be giving you a disorder for each, the outer ear, the middle ear, and the inner ear, along with the air and bone conduction results and the tympanometry results for each outer, middle, and inner ear disorder that I give for this presentation. But before we begin, let's go through briefly the anatomy of the ear. So again, the outer ear consists of the pinna and the EAC, which is the external auditory canal. Whenever you hear me say EAC, that's what I mean, is external auditory canal. As for the middle ear involves the tympanic membrane, which is right here known as the eardrum. It involves the ossicles, which is the malleus right here, the incus and the stapes, and the eustachian tube, which is right here. And the inner ear is made up the cochlear, which is right here, and the vestibular portion. Okay, so outer ear disorder. So to begin, as I stated previously, the pinna has its own intricate anatomies, and each of these have, as you can see, its own names, but for today we'll just call it the pinna. And when the pinna is affected, such as the picture here to the right, it can range to mild to severe conductive hearing loss. So the individual here on the right has actually two outer ear disorders. The first seen, obviously it's noticeable, is microtia, which is, and I quote, a congenital deformity of the outer ear. And the second, which is not going to be seen, is atrasia, which is congenital closure of normally open body orifice, such as the external auditory canal, per Martin and Clark. So basically, in layman's term, that just means that the EAC is just closed. And the usual treatment for microtia and atrasia is surgical procedure. And usually they take cartilage and natural tissue from the individual's body, so it can be from the rib, from the chest, and they reconstruct it into a pinna. This is a very advanced surgical procedure, and when that is done, usually the EAC is next to be fixed. The results usually are conductive hearing loss. As I mentioned earlier, the audiogram results will be somewhat similar to the picture on the left-hand side. The individual who this audiogram belongs to had atritic, which means that both external auditory canals are closed. It's just another way of saying atresia. As you can see, there's a bone conduction that appears in normal range, but the air conduction here is down below around the moderate severity level. And there's an air-bone conduction gap suggesting conductive hearing loss. And the tympanogram to the right-hand side is that of a type C, where the pressure in the middle ear falls below normal. And the reason why there's a type C, again, it goes back to the atrasia diagnosis, where there is closure in the EAC, so the pressure in the ear canal is off. So that will result in a type C tympanogram. Moving along to the middle ear, a middle ear disorder that can happen in the auditory system is called serous effusion of the middle ear. Usually serous effusion can be known by different names such as OME, meaning otis media with effusion, or SOM, which means serous otis media. According to the Children's Hospital of Philadelphia, serous effusion can result in, I quote, of a cold, sore throat, or upper respiratory infection, end quote. According to Martin and Clark, serous effusion is an occurrence of a partial vacuum in the middle ear where the fluid normally secreted by the mucous membrane lining of the middle ear may literally be sucked in the middle ear space. Again, to break that down, that's just meaning that there's fluid in the middle ear. So all this section right here, that's not, as you can see, there's just fluid. So all this right here is fluid. You can see it through the tympanic membrane through an otoscopy procedure. The treatment method for a serous infusion can range from, usually from antibiotics can clear the fluid to a myrigotomy, something like that, which is a small incision in the tympanic membrane to release the fluid and pressure from the middle ear. Again, it's myrigotomy. I do apologize, these words are difficult. But the results for that middle ear disorder, so serous effusion, usually is aligned with conductive hearing loss, and this can range from mild to moderate degrees. So the audiogram to the left is of an individual who is diagnosed with serous effusion. As you can see, there is an air to bone conduction gap with bone conduction in the normal ranges. This removes the possibility of it being sensory neural. The tympanogram results beside the audiogram right here are of a type B. So Martin and Clark stated that type B usually results, and I quote, when the middle ear space is filled with fluid, where the point of greatest compliance cannot be found, end quote. And so, as I said, serous effusion is when there is where there is fluid in the middle ear section. So type B would best fit this diagnosis. Okay, now moving on to the inner ear disorder. The inner ear disorder that can occur in the auditory system can be a unilateral hearing loss of Meniere's disease. So this is obviously a normal cohelia along with a normal endolymph. According to Martin and Clark, Meniere's disease of the inner ear can cause symptoms of tinnitus, and I quote, tinnitus, vertigo, and hearing loss, end quote, due to the increased endolymphic fluid in the labyrinth of the ear, also known as the cohelia. So this is Meniere's disease, when there is a lot of fluid in the cohelia, and it can be caused by blow to the heads, infections of the inner ear, allergies, or in really rare cases, tumor. And this is per Martin and Clark. The treatment to Meniere's disease can range from antibiotics to advanced surgical procedures, such as decompressing this endolymphatic sac. So they insert a shunt, which is into the spaces in the skull, and I quote, in the spaces in the skull, so that the fluid can be excreted along the cerebral spinal fluid. So a shunt will be inserted into the person's skull in order for this fluid to be drained. The results can show a sensory neural hearing loss, as in the audiogram here to the left-hand side. The individual whom this audiogram belongs to has a unilateral sensory neural hearing loss and is diagnosed with Meniere's disease. As you can see, the right-hand side has its bone conduction and air conduction results in the moderate to moderately severe hearing loss. And so when there is bone conduction here in the lower range, that's how you know that it's a sensory neural hearing loss. And the tympanogram, believe it or not, would result in a type A, would result in a normal tympanogram where there is no issue in the outer and middle ear function. Remember, a tympanogram is just to see the results of an outer and middle ear and to distinguish outer and middle ear diseases. So a tympanogram here will result in normal, in a type A. Again, thank you so much. Here are my references, and thanks to SlidesGo for providing this presentation, or these slides.